Mastitis. Introduction. Mastitis is the persistent inflammation of mammary gland. One or more quarters of the udder can be affected. The condition may alter the composition of milk secreted by udder, whereas mammary gland tissue undergoes abnormal structural and functional changes. It is one of the most economically important diseases of dairy cows, as it reduces the milk production along with changing the quality of milk and milk products. In severe cases, it leads to the disqualification and culling of cows. Milk from mastitis-infected animal is unsuitable for human consumption. The incidence of mastitis is more in early and mid stages of lactation in comparison to late stages of lactation. Cows, buffaloes, sheep, goats, pigs, horses are highly susceptible for mastitis. Heavily producing dairy cows are mostly susceptible than low producers. Causative agents. Some of the major causes of mastitis are as follows. Infectious causes. Bacteria approximately 70% like E. coli, Enterobacter spp, Klebsiella spp, Streptococcus spp, Staphylococcus sp, Pseudomonas spp, Corynebacterium, Pyogenes, Brucella spp, etc., yeasts and molds approximately 2%, like Aspergillus spp, Candida spp. The environmental factor approximately 28% includes physical trauma, weather extremes, unhygienic farm conditions, manure, bedding, barns, and floors, etc. See nutritional factor, the genetic factor. A breed of animal, exotic breed, and higher milk producing dairy animals are more susceptible. In our context, mastitis due to Staphylococcus. Streptococcus infection is more prevalent. Organism can invade inside the body through teat, canal, pore, milker's hand, ingestion of infected material from environment, biting flies. Also influences the entry of organisms. Clinical signs. It may be acute or chronic in nature. Both infectious and non-infectious causes are responsible for mastitis. It is of two types, clinical and subclinical. In clinical cases, signs are visible and clear, whereas in subclinical mastitis, visible signs are lacking. Depending upon the duration of mastitis, clinical signs can be observed as follows. 1. Per acute form, high fever, anorexia, respiratory distress, swollen, hot and painful udder, cessation of milk production. Exudates are often blood-stained. 2. Acute form. Udder is swollen and quality of milk is changed. Milk becomes curd-like yellow, brown fluid with flakes and clots. Low fever comparatively. 3. Subacute form. No changes in the udder tissue. Watery milk with abnormal color. Fever is generally absent. 4. Chronic form. Udder is thick, hemorrhagic, fibrotic, swollen with palpable mammary lymph nodes, yellowish or white. Fluid with clots and flakes can be found. In severe cases, nodules can be found in udder and later on become atrophied. Diagnosis. Physical examination of udder and teats showing. Inflammatory signs should be carried out if suspected. For mastitis, besides history and clinical findings, there are various tests available for the detection of mastitis. Some of them are as follows. Eye strip cup test. This test detects presence of flakes, clots, or watery milk. This is the most common means of detecting of clinical mastitis. To California Mastitis Test CMT, it is a simple cow-side indicator of the somatic cell count of milk. It serves as a useful technique for detecting subclinical mastitis, for which -3 milliliters of milk and 3 milliliters of CMT reagent is kept into each cup of CMT paddle and contents are mixed in a gentle, circular motion. In positive cases, mixture thickens immediately with gel formation. 3. Mastrip test. In this method, mastrip is dipped in milk and color. Change is noted within 30 seconds. Interpretation can be made on the basis of changes in color level. Of milk, color indication, yellow, normal. Greenish yellow, subclinical mastitis. Green advanced, subclinical mastitis. Blue, subclinical mastitis. IV. Other available tests include bromothiamyl blue test, BTB, chloride test, Whiteside test, catalase test, electrical conductivity test, etc. V. Microbiological culture can be done for the isolation and identification of the organisms. Treatment. Use of Mastilab cream thrice a day around affected udder area after milking. Stripping out the milk from the infected quarters. Clean infected quarters with normal saline or distilled water in regular manner. In infectious cases, antibiotics and distilled water. Solution can be infused if there is a blockage in teats. Poor teat cannula can be inserted. Antibiotics like oxytetracycline, gentamicin, penicillin, streptopenicillin, etc., IV or intramammary can be used for 5 to 7 days at a regular interval as per the result of antibiotic sensitivity test, AST, antipyretics, and anti-inflammatory drugs like meloxicam injection can be used as per the requirement. Antihistamines like chlorpheniramine maleate can be used. Vitamin E and selenium injection can be given. Intravenous therapy using normal saline or dextrose. Saline solutions can be given to reduce the toxic level in blood. In acute cases, local application of cold fomentation around udder surface. Prevention and control. Vaccination against mastitis has long been an active field of research, but for time being, mastitis vaccine is not very efficient. Farm sanitation and proper management of dairy animals is the key to prevent mastitis. Following measures shall be applied for prevention. Before milking, wash udder region properly with lukewarm water and dry with clean cloths. Or teats can be dipped in available antiseptic solution, like hypochlorite solution 4% available chlorine, 0.5%, chlorhexidine solution, or 1% iodine solution. Regular washing of milking utensils should be carried out before and after use. Milking person should always wash his/her hands before and after milking. After milking, teat canal can be blocked by using Vaseline gel or with glycerin mixture in order to prevent unnecessary contamination. Infected cattle should be milked at last after milking. Healthy animals, infected animals should be separated from other healthy animals and treated accordingly. Routine disposal of the soiled materials and thorough cleaning of shed using disinfectants is necessary.